Hello everyone, welcome back to the course on Health Humanities, Indian and Western Medical Knowledge Traditions. This is lecture number 42nd on gender, illness and health. In this lecture, I will talk about how gender norms shapes the experiences and perceptions of illness, how gender specific illnesses have been described in certain communities, in certain cultures, and how they shape or how it restricts one's day-to-day experiences. Further, I will talk about how biological, social, and cultural dimensions affect one's experiences of illness or how one has access to healthcare facilities. When we think about illness, illness is not something which is just biological. Illness is also socially constructed, culturally constructed, and the people who are having disease, their access to healthcare are also limited by the various social and physical norms. The people who are ill, and if they are male, they have different ways of approaching medical care facilities, and if they are female, they may have different approaches in certain communities, in certain societies. So when we think about the mental illness of women, they are more also society, they are also influenced by societal expectations. It tries to project that the representation of women who are having mental illness are something which is based upon particular biological functions, and it will try to impose some kind of cultural stigma and shame who are having mental illnesses. And in this way we find that illness and gender have a kind of intersection, and when it comes to women, then they face more social stigma, they face cultural stigma, they are made to be ashamed of certain kind of illnesses. So gender and illness are intertwined, they are interrelated, and further we find that the facilities for women and their access for healthcare can be specific to certain gender norms and gender roles. When we think about gender equality in health, then one can think about equal opportunities to achieve optimal health, that there can be equal opportunities for health facilities for both male and female. But it may not be so in the real cases, in the real life, because when we think about women, there can be certain kind of inhibition, certain kind of limitations, because they may have less education, they may have lesser money, they have lesser facilities compared to men. And when we discuss the notion of gender equity is about ensuring fairness and justice in how benefits, authority, resources, and responsibilities are shared between women and men. So the idea of gender equality and health is about maintaining gender equity, maintaining equal resources for both male and female. However, when we think about the condition of men and women, we find that they have different needs and they have different levels to access and control the resources. These disparities must be addressed when one talks about gender equality and gender equity in terms of health, because it causes some kind of imbalance in terms of accessing one's healthcare opportunities. Reaching gender equality will require targeted actions aimed at removing gender-based inequalities. How one can think about gender-based equalities in terms of healthcare? For example, suppose there is like a woman who is having certain gender-specific issue, and the doctors nearby her are all the male people, If the woman comes from a rural area and is not able to tell her problems, this may result her this may result that she may not share her health concern and may not get the adequate treatment. So the purpose of this lecture is to find out the means and to find out different modes through which gender bias can be reduced and healthcare facilities can be increased for women. When we think about what a World Health Organization says about gender and health, and we find that WHO has a long report about gender and health. It says gender influences people's experience of and access to healthcare. The way that health services are organized and provided can either limit or enable a person's access to healthcare information, support, and service. And the outcome of those encounters, health services should be affordable, accessible, and acceptable to all, and they should be provided with quality, equity, and dignity. This is very important that people should have equal access to healthcare, but gender impacts people's equal access. Gender affects one's access to the healthcare, because in some places, at certain communities, at certain areas, healthcare facilities can be organized in terms of certain gendered practices, and that can limit one's access. So when we think about gender and health, one has to consider whether one is having sufficient gender specific information, uh, whether one is having sufficient support, sufficient gender based support. So we need to have sufficient gender based healthcare information. We need sufficient gender based healthcare support and services, and we also need to see that what are the outcome of these encounters. For example, when a woman gets sick and living in a remote area, so is there enough facilities for her safety that she can walk over and go to the hospital, or is there like ambulances specifically meant for woman patients? This is a like issue which needs to be considered. And the health services should be affordable. In most of the societies, women are not the owners of property. They stay at home, they do the household works, and they do not have resources, they do not have money. So is it like they can afford it, they can easily buy medicines. When we think about Indian conditions, Indian family systems, we find that in most of the cases women are on the margins of healthcare facilities, and if like they get sick, sometimes they actually do not tell it, or they hide their illness. The reason is that because they come from poor families, they want to save the money for the healthcare of their children, other family members, thinking that if they tell their health concern to their family members, it will result in the loss of money. And in most of rural Indian societies, we find that women are having less access to the healthcare facilities. Girls are having less healthcare facilities, not because they do not want, but because they come from the poor and rural background, and they cannot afford the expenditure for these medical facilities. In this way, we find that that medical facilities should be affordable, and it should be given with quality, with equity, and with dignity. One should not give in the name of some kind of exerting power. So we find that the practices of gender and health are not not going hand in hand. Rather, they are built in the logic of some kind of operations, and there is some kind of disparities when health facilities are provided to the woman. When we think about gender inequality, discrimination, and barriers, we find that one can consider about the mobility of women, the restrictions on their mobility. Can they easily walk over? And how far it is? Is it safe? What are the restrictions? Are women allowed to go alone and consult a doctor? In most of the cases, it may not be. Can they decide about their health? What kind of where they want to go for medical treatment? And so they can take a decision about their health access. Can they decide the doctor by themselves? When we think in most of the societies, in most of the countries, then we find that in the patriarchal world, the decisions are taken by family members. The lower literacy rates also affects the access to the health care of women. And when we think about the developing countries, the poor countries, women are less educated. They have less literacy, and hence they have less awareness about their health concerns. Further, one can also find discriminatory attitudes of communities and healthcare providers. For example, that one, if the patient and doctor belongs to different communities, and there may be chances of some kind of discriminations, which is rare, by the way. Further, one can also consider that the lack of training and lack of awareness among healthcare providers and health systems of the specific health needs and challenges of women and girls. For example, when the specific health needs are specific health challenges of women. So do we have specific doctors? Do we have specific medical staffs in rural areas where they can get enough medical facilities? In the urban areas, there may be sufficient uh, doctors who are expert in the specific health concerns. It may not be the case in the rural areas. So the urban and rural divide can also affect health in terms of one's gender. So we find that there are several kind of barriers which affects the health of women when they need medical facilities, when they need medical care. And these barriers can be in terms of their transportation, it can be in terms of their decision making power, it can be in terms of their literacy rates, in terms of the discriminatory attitudes of the societies, communities, and also the lack of specialized medical facilities. Some of the common health concerns which we find in the case of women are unintended pregnancies, sexually transmitted infections, including HIV, cervical cancers, and malnutrition. Women who are living in the rural areas, who are not independent, and those who are surviving on the earnings of their family members, then they find that they have lesser access to medicine, they have lesser access to medical systems, and they have a different kind of health concerns which remains unaddressed. And when it comes to gender and access to healthcare, one has to also consider economic inequalities, the people who are poor and how they have access to the healthcare facilities. We find in these different societies that the poor people have less access to healthcare facilities, but among the poor societies, women have less access to the healthcare facilities. And when like we have two people, like a male and a female, who are getting some kind of health concern, then the priorities are given to the male people. Further, we find the people like who are LGBTQ plus are the people like who are transgender. How they have access to healthcare? Are they having equal healthcare concerns? Are they having equal healthcare opportunities? And are they seen with dignity in the healthcare system? These can be further questions to be addressed. So to conclude, gender and health are very vital, and it needs equitable healthcare facilities. It needs that it can be addressed without bias, and one can think about improving the health in terms of equity, in terms of equality, in terms of equal economic concerns. However, in most of the societies, we find that the health concerns are gender specific, and women and girls have lesser healthcare opportunities. Thank you.